When a patient leaves the hospital, a discharge summary must be completed and shared with the patient's primary care provider. It is an overview of what happened to the patient while in hospital and what needs to happen to continue care once they leave the hospital.
The primary care who needs to take care of that patient got to be in the loop. If they actually don't receive that information, then there's going to be a care gap, and there would not be a proper handover of crucial information.
In 2014, the University Health Network discovered this handover of crucial information wasn't working well. In fact, 38% of patients leaving the hospital were not getting a discharge summary.
It was really not acceptable at how many patients were leaving and not really knowing what's happening or why things changed.
So UHN committed to improving its discharge summary process.
The largest barrier to fostering innovation is being able to see what's really going on in the organization. And I think we're clouded by anecdotal stories and maybe some evidence, but we really wanted to see what was happening. And really, data was our guide. Some of the data that we surfaced showed that we need to make some change to policy. And some of the data showed that we needed to change behavior.
The first step is the taking the ownership that you should do it. Now the second step is do it and do it right away. Don't wait.
UHN analyzed the data and gaps were identified in discharge summary completion, delivery, and quality. The first step was to change UHN policy to mandate a reduction in completion time from 7 days to 2 days.
It's now completed internally. Does it actually get delivered? And we were shocked.
When UHN looked at data relating to timely delivery to primary care, it became obvious that significant improvements were needed.
Upwards of 60% of our providers in the database were missing or had incorrect fax numbers.
Every month, there's piles of discharge summary done. We tried to mail it out or fax it out, got rejected because there was no one there to receive it.
In some cases, it took 2 to 3 weeks after completion to get to the primary care provider. As soon as we saw that data, we knew there was opportunity to improve.
Improvements focused on the accuracy of primary care contact information. UHN updated its databases, engaged tens of thousands of care providers, and put in place new processes to ensure information was kept continuously up to date.
That was the good news. So that actually helped us to improve our our accurate delivery by a significant amount.
Next, UHN looked at the discharge summary itself. Was it good quality? Turns out there was no standard format or practice, and the discharge summaries ranged anywhere from 1 to as many as 30 pages.
Are they useful? Not always, not consistently. Here's a good note. Here's an example of a 20-page discharge summary. What am I supposed to do with this? That was our aha moment. What constitutes the right amount of information?
We boiled it all down to looking at characteristics that should be present within the discharge summary and listed it out and saying these items should be present.
Along the way, UHN consulted with experts, patient partners, and family physicians.
They really included a lot of the interprofessional team, including pharmacists and nursing and physicians. Having the right mix of people was really important. Everybody was listening. That was something really quite incredible. We go to a lot of meetings, they don't always have output. This had output, and it moved forward.
We worked with multiple patients, and their feedback has been great.
I think that was a really great part of the whole process. We met with the patients up front so that we could keep that kind of at the center as we move forward.
As well, UHN discovered a need for training and support to help educate staff on what a good discharge summary looked like.
The education component is critically important. There's a lot of educators and students that live in our organization, and we knew we had to build education opportunities for them.
There was a lot of education material set up for people, mock-ups of letters so that would be a guide for people, and this is what a good letter would look like, and this is what a not so good letter would be like.
the improvements to UHN's discharge summary process have been significant. 3 years ago, 62% of UHN patients had a discharge summary completed. Today, 93% of UHN patients have a timely discharge summary completed. And 3 years ago, 40% of discharge summaries were auto-faxed to primary care within 30 minutes of completion. Today, 89% of discharge summaries are auto-faxed to primary care within 30 minutes.
Looking at data was one of the biggest learnings, and it really changes what we talk about, and also energizes when we do well, but it also enables us to think differently when we may be not doing so well.
It's a success story that UHN is now looking to grow and share.
We're already sharing with our neighbor hospitals to help provide opportunities to other organizations to look for improvement. We are never done. We're seeing lots of opportunity across the organization to drive the same methodology and same approach for improvement.
I think it will make the healthcare more efficient. From the patient's perspective, they will feel that they are in good hands, that the hospital provider and the primary care provider actually are connected. There won't be any gaps in care. And whereas 10 years ago, the question is, why am I doing it? And 10 years later, we are saying that we are doing it, and so that's a huge change.
To learn more, visit our website